The University of Miami / Jackson had identified all these kids being born with HIV. They got this program to deal with the development of these children. Unfortunately, in the very early days, kids weren't living past the age of 5 and 6. With the onset of new meds and the way that things were changing, we started seeing adolescents with HIV growing into young adulthood. And they're having children now, which is great. And most of these kids are negative, it's awesome. But again, we hadn't really seen, because of, I guess, lack of prevention, lack of foresight, whatever the reasons are, this whole adolescent population was growing. So we started identifying that in key cities around the country. So we're kind of behind with grappling the disease for adolescents. It's affecting them faster than any other subpopulation in the country. They are very far removed from the early days of the pandemic, where we would see someone would catch HIV, turn into AIDS, and then die very quickly. So they're very removed from that. So when we talk to adolescents about kind of like the old days of HIV, they have no concept of that whatsoever. But anybody that works with adolescents and anybody that's a near peer to adolescents know they are a subpopulation and need absolutely adolescent-specific care. In their brain functioning, they're still developing. In their bodies, they're still developing, alongside with the emotional and cognitive side. So as a provider, you can't expect them to grasp a lot of concepts. You still can't grasp them to understand the terms of harm reduction what an adult would do. Adult care isn't suitable for an adolescent. They're still trying to grasp on who they are and what they want to become. So as providers in this field of HIV care, we have to have tailor-made efforts for adolescents. They are a subpopulation. They're not kids and they're not adults. We're not going to do it with a 4-year-old. We're not going to do it with a 44-year-old. Our specialty is adolescent care. We're one of the very few places in the state of Florida that exclusively works with adolescents. There's two things that we're seeing. One is, I guess, an apathy towards the disease. Again, they're so far removed from the old days of HIV/AIDS, it's just a different world to them. They're not getting proper education. In social media, kind of like the norms of society, no one really discusses HIV anymore, and you don't really see it in the news. So they're not being bombarded with anything. They are quite savvy. If we can get them as an audience and discuss like prevention and harm reduction, they're very open to it. So I feel that if we could work more closely with the population and kind of get them in as an audience, I think we could see the transmission rates going down, because even though they're risk takers and even though they like to maybe, party for the first time in their lives and don't put on a condom when they have sex, I think that if they were involved in the actual solution to this, they would come up with creative ways in stopping the transmission rates.